Hi everyone, very good morning, guys. I hope I am audible and visible. I am very sorry for a slight delay. There were some network issues. It's quite a sad event that on this particular day, all of us have decided that we will have a 1 hour session of microbiology, which is not one of the liked subjects by most, but we don't have an option because we have an exam coming up. And when there's an exam round the corner, then all the other things need to take a backseat. So, yes, on that note, let's begin with microbiology. And like yesterday, we will have a quick discussion of few questions just to give you a kickstart early morning. And the PDF, like yesterday, will also be shared over Telegram, so you don't have to sit and write anything. You just have to answer a few questions, and that's about it. That should help you get your day going, right? Okay, so on that note, I hope everything's okay with the AV and we can begin. We'll start with the PYQ, okay? We'll start with the previous year question, and this is what you have to attempt first and foremost. Then we'll start with the discussion. So, clad medium. Clad medium is considered better than McConkey agar for which of the following reason that we are starting with? So it differentiates lactose from non-lactose fermenter, prevents swarming, inhibits the growth of commensals, or it allows staph and candida to grow. So I think I've started getting the right answers. The reason that clad is considered better is going to be option number D. So I'll come back to this question. First, I want you to look at both of these. I want you to look at Cled and McConkey agar. So the first set of questions that I'm starting with are all these fermentations. Lactose fermentation, sucrose fermentation, mannitol fermentation, कौन सा media है, what are their indicators, what are their colors. So we need to make a list of those, okay? So yes, many of you marked A also, and I'll tell you what is the right answer is obviously D, but I'll tell you all the options. First, let's discuss McConkey versus Cled. The reason of why I choose both of them is both of them are able to tell me lactose versus non-lactose. तो ये इनका difference नहीं है. Lactose versus non-lactose fermentation, both of them are able to tell me. So this is an advantage of both. So what is McConkey containing? This is a previous year question. We have peptone, lactose, agar, neutral red, and taurocolate. So now go into a little bit detail. Peptone and agar are present in every agar, be it a nutrient agar or a blood agar, ये सब में होता है. Then we have lactose. Why? Because I want to test for lactose fermentation. Again, it's there in everything. I have taurocolate. What is taurocolate? Taurocolate is going to be the sodium taurocolate, basically the bile salts. Is there any reason that I have added bile salts? Because bile salts will inhibit swarming. Guys, which organism shows us swarming? Swarming matlab wo round round wala movement, round round wala motility and growth. So swarming is something which is shown by Proteus. So I don't want that motility to happen. So bile salts are always toxic, right? Bile salts are always going to stop that motility. That is the reason that we add bile salt so that the motility does not happen. Finally, why do we add neutral red? Because that is the indicator. This comes as a question. What is the indicator used in McConkey agar? It is the neutral red, and indicator means color change will occur. So tell me guys, what is the color change that you see when lactose is fermented? What is the color change that we get? The color change is going to be pink. And here I'm going to tell you a trick for all the fermentations. देखो lactose होगा या sucrose fermentation होगा या mannitol fermentation होगा, कोई भी fermentation होगा, the color will always come out to be yellow. But McConkey is the only pretty pink lactose fermenter. The only place where pink fermentation hoga wo McConkey hai. Everywhere else I will talk about yellow. So now when I come to clad media, firstly there are two questions that will come in clad media. They will ask you the indicator for this also. The indicator for clad media is bromothymol blue. You can see the background is so blue also. Bromothymol blue is the indicator, and what is the color that you're going to get? The color that you will get will be a yellow color. Everyone's okay with this? तो अब इसके आगे हर जगह yellow, yellow, yellow. Only McConkey was pretty pink. So now the next question is that which of these are better? Because both of them are testing lactose fermentation. Cled is said to be better because in which situation are you using these two? Let's consider a case of urinary tract infection. Urinary tract infection is most commonly caused by gram-negative organisms, but urinary tract infection can also be caused by gram-positive organisms like even staphylococcus can cause, even candida can cause. So UTI can be caused by all. So CLED is more lenient. CLED allows everyone to grow. It will allow gram positive also to grow. It will allow gram negative also to grow. McConkey, on the other hand, is only and only for gram negative. It doesn't allow the gram positive organisms to grow. So coming back, is the clad media considered better because it allows all the other gram positives also to grow? Yes, that is right. All the others are common points. देखो clad होगा या McConkey होगा, both of them are going to help me differentiate. Both of them prevent swarming. Both of them prevent the growth of other organisms. These are common points. The better reason for clad is that it is allowing other organisms also to grow. यहाँ तक clear हो गया? Can I twist the question a little? And indirectly, if I ask you this indicator used in McConkey agar, this was also a previous year question. Now it becomes so simple that the indicator will be a part of the plant mnemonic. And yes, we are going to have neutral red. So now tell me, what are the two lactose fermenters, the main lactose fermenters that you have? Because after that, we are going to start another set of questions. Lactose fermenters are what? The KK wale sounds, matlab coli and Klebsiella. Coli and Klebsiella, the KK ones are going to be lactose fermenters. All the others are going to be non-lactose fermenter like Salmonella, Shigella, Proteus. All the others become non-lactose fermenters. E. coli and Klebsiella means on McConkey agar, what color will they give? McConkey is the only one which was giving a pretty pink color. Otherwise, baki sab mein yellow color. So this is going to give a pink color. How will I differentiate? ये भी pink color देगा, ये भी pink color देगा. How will I know whether it is E. coli or Klebsiella? So now let me show you another thing. Look at this. This is McConkey agar and I've got a pink color. McConkey agar pe pink color matlab lactose fermenter. Two options in front of me. Either it is E. coli or it is Klebsiella, but I believe it is Klebsiella. Why? Because Klebsiella is capsulated. Remember, any kind of capsulated organism, what kind of colonies does it give? This is a rule. Any kind of capsulated organism gives mucoid colonies. Look at this. It's just not pink. It has that shine, that jelliness. See, when I'm trying to lift it, वो ऐसा stringy कर रहा है. That is why I'm getting to know, okay, if it's a mucoid pink colony, mucoid matlab capsule. Capsule is something that I will get with Klebsiella. So to differentiate E. coli from Klebsiella, Klebsiella will give you a mucoid colony. So see a question related to this. Have a look at this question, which might help you analyze this. What do you have? The blood of a patient suspected to have a pyogenic liver abscess was sent for culture. The colony morphology shows large mucoid colony. सबसे पहले तो mucoid word and a positive string test. I know string test is making you think of something else. String test हम usually किसके लिए बात करते हैं? Can you tell me all the string tests that you have? There are 3 string tests. Everyone, quickly tell me. The first string test, which is very famous, is obviously for Vibrio cholera. Vibrio cholera का string test ज़्यादा famous है. Vibrio cholera, the rice water stools. But even this Klebsiella shows you a string test. Even this Klebsiella, why? Because it had that mucoid colony. When I'm trying to pick it up, it's becoming stringy. ये दोनों तो microbiology है. Tell me one string test from clinically from parasitology. Excellent. The string test that you do in a patient, that is for giardia, where you call it the entero test also, because in the intestine you send a string. This is inside the patient, you send it in the intestine, in the duodenum, so wo patient wala string test. And these two are microbiology culture wala string test. So coming back here, what you were seeing, this stringiness is also a string test. Now when you come back to this question, there's a positive string test and a mucoid colony. Both of them together are coming in favor of Klebsiella. ये सब clear हो गया? All these 2-3 questions of how things can be twisted and turned around are clear to everyone. So now tell me on the same basis another question. Which of the following, first I'm doing all the fermentations, okay? So which of the following is used to differentiate colonies of Vibrio cholera and Vibrio parahemolyticus? So yes, again Vibrio पे आते हैं. अभी string test करा था, तो tell me the culture media also. The answer, which I'm very sure everyone knows, is TCBS. तो अब ये वाला भी देख लेते हैं. What is TCBS? TCBS means S for sucrose. Now I have come to sucrose fermentation. Have a look at this picture, guys. This is TCBS and here I am trying to measure sucrose fermentation versus non-sucrose fermentation. Now it's in front of you. Sucrose fermentation का कौन सा color आया? Everywhere the fermentation comes yellow. The only place where it comes pretty pink was McConkey. McConkey was pretty pink. Everywhere else fermentations are yellow. So sucrose fermentation matlab Yellow color. Which organism shows you sucrose fermentation? Vibrio cholera shows you sucrose fermentation. Vibrio parahemolyticus does not show you sucrose fermentation. So that is the question that I asked you, that which of them is used to differentiate cholera from parahemolyticus. It is going to be the TCBS, sucrose. So iska bhi tell me the sabka, what are we doing? All media, you need to know the color. Color sabka yellow hai. Next you need to know the indicator. Can you tell me what is the indicator for TCBS? For this also, see, the background looks very, very green. That green color is because it has bile salts. The greenish color is because of bile salts. Don't believe that bile salt is an indicator. No, bile salt is not an indicator. Iska bhi indicator. Who will tell me this? This is a tougher question. So let's see. Thiosulfate, citrate, bile salt, sucrose. Indicator का नाम is not in the name of the culture media. Iska also it is going to be bromothymol blue. Just in case we did not know, iska also will be bromothymol blue. Although it's giving that green color, but that green color is because of the bile salts present. So iska also is BTB, bromothymol blue. Everyone's okay with this question also? Yes, we've got an answer finally, which is good. तो एक और कल्चर मीडिया हो गया. सो नाउ विब्रियो का इतना बात करा, तो लेट अस लुक एट एवरीथिंग अबाउट विब्रियो. व्हाट आर द क्वेश्चंस ऑन विब्रियो कॉलरा दैट आई एम गोना गेट? Number one, everyone knows what is the shape of it. It is a comma shape organism. Point number one. Second, we all know what is the stool that it's going to result in, the rice water stools or the cholera infection that we know. Now I've done that. Okay, Vibrio is a sucrose fermentation, so it's going to give me a yellow color on a TCBS media. And you know this finally positive string test that I was telling you. It is also going to be a positive string test. Dr. Praniti, we've been doing from the beginning. BTB is bromothymol blue. It's an indicator. Bromothymol blue. That is what is BTB. Is that okay? So coming back, yes, it shows you the string test also. Someone asked me Chinese letter किसमें था? नहीं, Chinese letter इसमें नहीं था. Chinese letter was in Corynebacterium diphtheria. Chinese letter. अच्छा, now that you've asked me Chinese letter, let me ask you two questions. Chinese letter microbiology में कहाँ है? Chinese letter orthopedics के कौन से bone lesion में है? So Chinese letter, when you're asking me in microbiology, it is Corynebacterium diphtheria. But if I ask you, there's a bone lesion, orthopedics, patho, whatever you want to say it, where else? Fibrous dysplasia. Fibrous dysplasia shows you Chinese letter trabeculae. Very good. Fibrous dysplasia में Chinese letter bone obviously bony trabeculae, and ये microbiology का Corynebacterium diphtheria. ठीक है? So this was Vibrio is nothing to do with Chinese letter. ठीक है? All these are done. एक और fermentation वाला question है. Indicator used in MSA. Mannitol salt agar. So now I'm talking about mannitol fermentation. Mannitol salt agar, that is MSA, is going to be what? So finally the answer to this is phenol red. Phenol red. We are going to make a table. अभी एक table बनेगा, सबके colors, सबके indicators. Yes, you're right. Phenol red. So first let me look at mannitol salt agar. You can also see the reddish color, which will give you that hint that हाँ mannitol salt agar में there is red color. So firstly I've written the indicator is phenol red. Now tell me a basic question which you all know. Whenever mannitol will be fermented, what is the color that you're going to get? Sari fermentations ka color yellow. All fermentations are going to be yellow. Is that okay? So यहाँ पे mannitol is fermented. Which organism shows you mannitol fermentation? Staph aureus shows you mannitol fermentations. बाकी जो भी micrococcus, staph, other epidermidis, all of them are non-mannitol fermenters. Only staph aureus is a mannitol fermentation. In fact, I want to ask you, mannitol salt agar कौन से type का media है? There are actually 3 properties which they ask you in the paper. Listen carefully. Mannitol fermentation. It is telling me mannitol fermentation versus non-mannitol fermentation. Is it telling me a difference? Can I call it a differential media? Means it is telling me the difference between two things, fermentation या no fermentation. Number 2, salt. Salt is making it selective. Salt is making it a selective media because salt may only staph will grow, others are not growing. So salt has made it selective. So simple, mannitol has made it differential, salt has made it selective, but also it has an indicator. So can I also call it an indicator media? It has phenol red, so I'll also call it an indicator media. So that means mannitol salt agar, mannitol se differential, salt se selective, and phenol red se indicator intermedia. Everyone's okay with this? I asked you a simple question. What is the indicator? You know it is phenol red. So up finally guys, make a table for me. These are all the indicators that I've taught you since morning in 10 to 15 minutes. Jaldi se bana lete hain. So I know mannitol obviously is going to tell me for mannitol fermentation, and the organism that we are talking about is Staph aureus. What is the indicator that we studied over here? The indicator over here was phenol red. Coming to the next, TCBS, thiosulfate citrate bile salt sucrose, sucrose fermentation. कौन करता है sucrose fermentation? Vibrio cholera. What is अब? This is the different one. देखो बाकी सब में तो color दिख रहा था, but TCBS में looks green. But what is the indicator? It is bromothymol blue. Cled is going to tell me lactose fermentation. McConkey is also going to tell me lactose fermentation. The two lactose fermenters that you told me were KK wale, that is the E. coli and Klebsiella, same over here. But Cled is going to have bromothymol blue because it was blue looking. McConkey was having plant mnemonic. McConkey में क्या था? Plant mnemonic. मतलब what was N? Neutral red. The indicator was neutral red. Also now all of you will mark the colors. What is the fermentation ka color that you get in all of them? In all of them, any kind of fermentation that you might be talking about, I am highlighting it as yellow. Where is the only place where you're gonna get a pink color? The pretty pink color is only going to come with McConkey. I hope now this table will stay in your mind as it is. बस यही सीधा याद आना चाहिए in the exam. Everyone's okay, because now I'm going to show you another image based question going all the way back to these fermenters. Yes. Now tell me that ये जो fermenters थे, lactose fermenters, E. coli, Klebsiella, both of them were almost same. वही yellow color, वही pink color, everything was same. So now, are there any testings? Quickly answer. कौन सा testing होता है? कौन सा test tube वाला testing होता है? On the basis of which we can differentiate, which all of you keep writing to me that ma'am we can never ever learn this Invict testing that you have, and there's an entire table that is made, and how should we be learning this? Yes, so very good. Invict testing. तो पहले तो what is Invict? A quick recap of what is Invict. There are these 4 tests that we are doing. So I for what? You can see it written in front of you. I for indole, M for methyl red, V for the VP test, and C for the citrate test. How many of you hate this particular test? I'm sure many of you, because I also used to dislike it during my preparation phase. So Invict testing, there is indole, then methyl red, then VP test, and then citrate utilization. So सबसे पहले तो if this is given to me as an image based question, how will I know what is positive, what is negative? So in most of the cases red color मतलब positive. देखो यहाँ पर इंडोल में रेड कलर आया मतलब पॉजिटिव, मिथाइल रेड में रेड कलर आया मतलब पॉजिटिव, वीपी में देर इज नो रेड कलर मतलब नॉट पॉजिटिव। लेट्स लुक एट द अदर। यहाँ पे इंडोल में रेड कलर नहीं आया, नेगेटिव। मिथाइल रेड में रेड कलर नहीं आया, नेगेटिव। VP में रेड कलर आया, पॉजिटिव। सो सिंपल वन लॉजिक इज, आउट ऑफ ऑल दीज थ्री, आउट ऑफ ऑल दीज इम वी तक रेड कलर मतलब पॉजिटिव। ठीक है, रेड कलर मतलब पॉजिटिव। एंड फॉर सिट्रेट व्हाट कलर इज पॉजिटिव? फॉर सिट्रेट अ ब्लू कलर इज पॉजिटिव। सो आउट ऑफ दीज टू टेस्ट ट्यूब्स विच सिट्रेट इज पॉजिटिव? ब्लू वाला सिट्रेट इज पॉजिटिव। सो पहले तो ये रट्टा लगा लो that out of IMV, indole, methyl red and VI, VP test, that is we have red color positivity. Citrate के लिए blue color will be positive. So now there's a long table which you might have seen in your books, which is always and always so difficult to learn. Have you seen this? So have you seen this? We'll be doing that once again, Dr. NS, don't worry. So E. coli, Klebsiella, Enterobacter, Citrobacter, Shigella, Salmonella, Proteus, Yersinia. What family am I talking about? I am talking about the Enterobacteriaceae family. Enterobacteriaceae family, just have that faith in me. Whatever I am making you learn, utna yaad karna. Do not learn this entire table because you'll end up forgetting. तो सबसे पहले, what are the fermenters? You told me KK wale are fermenters. They are the lactose fermenters. Everything else becomes non-lactose fermenters. This table is okay, and maybe you've not seen this table in the books, but if you read this entire chapter, then the entire chapter is revolving around this only. ठीक है, तो lactose fermenter कौन सा वाला था? KK sound वाला, मतलब E. coli, Klebsiella, and all the others become non-lactose fermenter. After that, you have to know their motility. Pick up the ones which are non-motile. Try to pick them up. Klebsiella is non-motile. Then I see Shigella is non-motile. You know, there are some very, very rare salmonellas. Very, very rare salmonellas which can be non-motile. तो कैसे कैसे याद करा? Yes. So these students have only taught me, especially interacting with students all over the country also gives you exposure to different languages. So we are now going to learn illa. Illa matlab no. Illa means no, है ना? तो Klebsiella illa no motility. Shigella illa matlab no motility. Rare वाला Salmonella illa matlab no motility. Gallinarum, yes, you are right, and even Pullorum. So there are different types of rare Salmonellas which are non motile. So basically ella matlab no. Klebsiella, Shigella, rare वाला Salmonella, ये ella मतलब no. ठीक है? These are non motile. बाकी सब में motility. Easy हो गया. Again, this is not a tough part. One column is done, second column is also done. Now we come to this Invict वाला testing. So again, this is also very simple. सबसे पहले differentiate करना था between E. coli and Klebsiella. तो simple. E. coli and Klebsiella alphabetical order में लिखो. First you write E. coli, then you write Klebsiella, and then you write plus minus and दूसरे वाले में उल्टा minus plus. So now coming back, if I've written plus minus means I'm dealing with a case of E. coli, and if I write minus plus, then I'm dealing with the case of Klebsiella. And you know how to pick up the plus and the minus, red and blue. तो यहाँ पर apply करके देखते हैं. Let us see this. First I got this picture in the paper. I said okay, I, M और VI के लिए तो रेड कलर है, तो ये है पॉजिटिव, ये भी रेड कलर पॉजिटिव, यहाँ रेड कलर नहीं है तो नेगेटिव. सिट्रेट के लिए ब्लू कलर वाज पॉजिटिव, तो ये भी नेगेटिव है. प्लस माइनस व्हाट विल यू राइट दिस इन द पेपर? यू विल राइट दिस एज E. coli plus minus. आगे बढ़ते हैं. Let's look at the other one. So first I know for the first three I have to concentrate on red color. यहाँ red color नहीं है, so this is obviously negative. Here also we don't have a red color, so negative. Here we have a red color, positive, and here we have a blue color, so positive. Minus plus. I will label this as Klebsiella. इतना तक क्लियर होना शुरू हुआ. प्लस माइनस प्लस. तो इकोलाई क्लेब्सियला एक दूसरे का हो गया ऑपोजिट. नाउ आई एम गोना टेल यू विच आर द वंस विच आर ओनली मिथाइल रेड पॉजिटिव. Only methyl red positive, that is it. So I am shy means I am shy and turning red. So I am shy and turning red. So remember methyl red, shy and turning red means what? SH for Shigella and Y for Yersinia. So which are the ones which are only and only methyl red? Repeating, सिर्फ एक जगह प्लस आएगा, methyl red में प्लस आएगा. तो remember I am shy and red. तो methyl red is gonna be shy for Shigella and Y for Yersinia. ये वाला भी हो गया, तो बचा क्या? Now only Salmonella is left. Now tell me this. I'll make you learn this also in a very nice manner. Salmonella का एक टेस्ट होता है, very famous Vidal test. And what is the sequence of Vidal test that we always study? Quickly let me know, guys. What is the sequence of Vidal test that we study? We always study OH. पढ़ते हैं ना? O antigen, H antigen, O antigen, H antigen. Do we study that? Yes. The Vidal test, everyone remembers. तो अब इस OH because salmonella से हमेशा we always learn that OH ही याद आता है. तो salmonella का कुछ वैसा ही. Let us find out a mnemonic so that I can learn both the things together. What is O antigen, H antigen? तो O से हमने बनाया O, I'll write it again, OH. And from this you can very well make this as negative and H as positive. O as negative, H as positive. तो अब बताओ, नेगेटिव पॉजिटिव. सो OH. जैसे OH याद करते हो फॉर विडाल टेस्ट, वैसे ही माइनस प्लस द वे यू राइट इट, यू आर गोना लर्न इट इन द सेम वे. सो O इज गोना बी लाइक अंडा मतलब नेगेटिव एंड H इज गोना बी है पॉजिटिव. O इज अंडा मतलब नेगेटिव, H is gonna be positive. So minus plus becomes for salmonella. So if you feel that you're forgetting, let me take a test. And once we do this test, I'm sure all of you will feel confident. Tell me, if I'm giving you, no one will write Invict for you. They will just say Invict test is minus plus minus. क्या क्या सोचोगे? What all will you think in the paper? Only and only methyl red is mentioned as positive. So I am shy. मतलब this is going to be either a Shigella or it is going to be a Yersinia. Everyone's okay? Let's move on to the next one. If I say plus minus, what is your answer? सिंपल, सबसे इजी वाला, स्टार्टिंग वाला. प्लस माइनस वाज E. coli एंड उल्टा कर दिया. इफ आई डू माइनस प्लस देन यू आर गोना कॉल इट Klebsiella. So simple. Okay, then let me ask you the next one. If I say it is a case of minus plus minus plus. What are you gonna say? Minus plus minus plus. So under H. What was that? That was a case of salmonella. तो अब difficult लग रहा है? All this Invict testing in the beginning that you guys had told me कि मैम very difficult. I will not be able to do this. तो अब वो table easy हो गया. And tell me, out of all of these, what is the motility? Motility तो सबसे favorite है. The illa ones are gonna be no. Illa means no. So illa मतलब non-motile. Klebsiella, Shigella, rare wala salmonella, these are all going to be non-motile. Out of these now we are left with just one part of the table, urease. तो ज़्यादा कुछ नहीं याद करना. Klebsiella is urease positive and Proteus में तो नाम में ही लिखा है. Proteus तो you have to learn because Proteus, God when made Proteus, he wrote urease in its name. Proteus is urease positive and that is the reason that Proteus ends up making so many of those stones. कौन सा वाला stone होता है guys? कौन सा वाला stone? Yes. Very famous staghorn calculus, everyone knows na. तो उसके लिए तो you don't have to wait for, I don't have to wait for the answer. You know, staghorn calculus, triple phosphate wala stone. Very good, perfect. So finally, one huge chunk of our image-based session for the day, which I was targeting, is done. अब इतना tough के बाद, let us go on to little simple one, which you might feel more comfortable in. So this is the next part. The image will come gradually, but first you're gonna tell me the answer to this. Much expected all time. Okay, yes. HIV positive person with diarrhea, stool examination shows a round acid fast cyst with 25 microns diameter. And what is that? Diagnosis. So now see, there was a little bit of a discrepancy over here, but at the end of the day, सबने size देखा and size पे, this is a question that has come only once many years ago, but because it's always a little controversial, so I've got it. So there's again, most of you are writing option B versus D. B versus D में आ रहा है, ठीक है? तो size देखो, size तो is a huge one. 25 माइक्रॉन्स आइसोस्पोरा को आजकल ये भी बोलते हैं सिस्टो आइसोस्पोरा भी बोलते हैं. सो लेट मी कम डाउन टू दिस टेबल. सी व्हाट आर दीज पैरासाइट्स? वी ऑल नो वी आर टॉकिंग अबाउट अ फैमिली ऑफ coccidian parasites, and when we are talking about coccidian parasites, I've written them in an alphabetical order. Cryptosporidium, cyclospora and isospora को sometimes they also call as cystoisospora, so it means the same. ठीक है? History will always be an immunodeficient person, and that immunodeficient person will be suffering from diarrhea. Immunodeficient person will be suffering from diarrhea. So सबसे पहले let's start with the size, shape, acid fast and all of it. So please remember that size I start from 4 to 6 microns and then double, triple. That is what you will do. 4 ka double 8, 6 ka double 12. So cyclospora ka size becomes 8 to 12 microns. Then 12 lo, double and triple, 24 to 36 microns. In your question, 25 microns was mentioned. So isospora is the best answer, and instead of writing isospora, they wrote cystoisospora. So that is the same. अब controversy कहाँ पे आया था कि round लिखा था, because now I'm going to tell you their shape also. तो देखो जो CC से लिखोगे cryptosporidium, cyclospora, उनको round बना देना. They are going to be round over here, and this is also going to be round over here. But this is isospora. Isospora you write like an eye. So I is going to be oval. Isospora is going to be oval. So repeating once again, the ones which you write with a C, they are going to be round, and the one which you write with an I, that is going to be oval. So yeah, ideally यहाँ पे oval होना चाहिए था, but I cannot just look at the shape and ignore the size. The size is 25 microns. Size will always be my primary concern in the paper when I get an HIV positive patient with diarrhea. Moving on, coming to acid fast. Of course, all of them are acid fast. All of them are acid fast, but sometimes which of them can be non-acid fast, sometimes variable, that is cyclospora. So we have learned cyclospora is cyclical. Cyclical means sometimes it is acid fast, sometimes it is not. Kabhi hai, kabhi nahi hai. So which of them is going to be cyclical? That is cyclospora is cyclical. In fact, cyclical will always remind me cycle. साइक्लोस्पोरा में सब कुछ साइकिल जैसा लगता है. साइकिल जैसा मतलब sometimes it is acid fast, sometimes it is non acid fast. So now the next question you'll also ask me, ये होता कैसे? How do these happen? By eating contaminated food and water. Their mode of infection is ingestion, contaminated food and waters. But out of these, which of them is by consumption of contaminated raspberries? So students have always, these my plus class students had made this mnemonic while during a live class, I remember. They said, ma'am, patient cycle pe raspberry lene ja raha hai. Patient is going on a cycle to buy raspberries. So remember, I don't know who on this planet goes on a cycle to buy such a nice fruit like raspberry. But yeah, cycle पे raspberry लेने जा रहा है, and cyclical मतलब cycle सब कुछ, cycle पे raspberry, cycle पे plus minus, sometimes it is acid fast, sometimes it is non-acid fast. Okay. Finally, which are the ones which are going to shine on their own? Autofluorescence, the Spora brothers. The Spora brothers shine a lot. The Spora brothers are going to shine a lot. Cyclospora and Isospora. The other one, Cryptosporidium, does not shine. So remember, Spora brothers will shine. Is that okay with everyone? Finally, coming to the treatment. Spora brothers का treatment है cotrimoxazole. स्पोरा ब्रदर्स का ट्रीटमेंट है कॉट्रिमॉक्साजोल. एंड क्रिप्टोस्पोरिडियम, तो क्रिप्टोस्पोरिडियम का ट्रीटमेंट है नीटाजॉक्सोनाइड. एंड दिस ऑल्सो आई रिमेंबर मेकिंग दिस निमोनिक इम्प्रॉम्प्टू विच वी मेड ड्यूरिंग अ प्लस क्लास. तो क्रिप्टो करेंसी किसके पास? क्रिप्टो करेंसी किसके पास? मैक्सिमम मनी क्रिप्टो करेंसी किसके पास? नीता अंबानी, राइट? सो क्रिप्टो करेंसी, क्रिप्टोस्पोरिडियम with nitazoxanide, and the other spora brothers are going to be treated with cotrimoxazole. Everyone's okay with this entire table? Because now we are going to put it up into proper diagrams. So what is this stain? Acid fast, Zn stain. But in this family we don't do the usual Zn stain. We do the cold Zn stain. तो K वाला sound याद रखना. Cold Zn stain मतलब it is going to be known as what? K से Quignon stain. Cold Zn stain is known as the Quignon stain, and remember this is done for the coccidian parasites. So K. Remember we have cold Zn stain which is done for cold quignon coccidian. Cold quignon coccidian. Now when you look at this, you will say, okay, ये भी पूरा acid fast है. All of them are pink in color. Over here also all of them are pink in color. But over here, some of them are pink in color, and can you see some of them are totally absent, totally negative. तो ये वो cyclical वाला होगा. This must be the cyclical wala, the cyclospora, that sometimes it is acid fast, sometimes it is not. This must be cryptosporidium then, because it is round, and this is oval. If this is oval, then this must be isospora. So see, in the exam, all that you've read in the table becomes so easy to implement also. I hope everyone's okay. No confusion. Abhi tak clear ho gaya. And this table, you know, it came in INICT, it has come in NEET PG, it comes in FMG, it comes in every exam of this country. You have to have HIV positive diarrhea in one of these in front of you, and I think you will be able to easily sort it out here onwards. Yes? Can we move forward to the most expected in every exam paper which you have to know, and that is the story of this. Operculated eggs are not produced in. Sub time ka favorite question. Operculated eggs are not produced in. Okay, so I think that's an easy one, and that is going to be, of course, C, schistosoma. You did not even give a thought to the others because you know for a fact that schistosoma में spine वाला eggs होता है. तो पहले तो let me look at what are operculated eggs. So operculated eggs are the eggs which are going to be a lid. I've just given an example of fasciola hepatica, but it is just not fasciola hepatica. It is operculated eggs in what all, which you are going to tell me. ये जो lid वाला eggs होता है, the operculated eggs होता है, they are seen in STD. What is STD? So lid is like a, can you see, lid is like a protection to the egg. So lid is like a protection, and protection is needed against STD. So S matlab spirometra. S matlab spirometra shows you operculated eggs. Then Diphyllobothrium latum shows you operculated eggs. All the trematodes show you operculated eggs. So like I had written fasciola hepatica, that was a trematode, but all trematodes except, excellent, except the rebellious schistosoma. Schistosoma कुछ भी trematode वाला show नहीं करता. It always goes opposite. So firstly, who all shows you operculated eggs? We have spirometra, we have trematodes except schistosoma and D latum. So let me come back to this question. Paragonimus westermani is a trematode. Clonorchis is a trematode. तो ये तो हमारा trematode में आ गया. Spirometra is not there in the options. Diphyllobothrium latum is there in the options. ये सब हो गए operculated eggs. The one which is non-operculated is schistosoma. So schistosoma shows you what eggs? Everyone's right. Schistosoma is going to be S. That is The spinous eggs. Schistosoma will show you the spine wala eggs, S for S. And these are the three schistosomas that you have to know. You have schistosoma hematobium. Hematobium is the only one that has a T inside it. Hematobium. तो इसका जो spine होगा, that is going to be a terminal spine. The इसका spine is terminal, right? So schistosoma hematobium is going to be terminal. Then we come to schistosoma mansoni. Mansoni means sleeping man, leta hua man, sleeping man, leta hua man. So that is going to show you a lateral spine. Very, very good. So leta hua man, lateral spine. Finally, schistosoma japonicum. Japonicum hardly shows you a spine only, spineless. Japonicum, spineless. So ये हो गया rudimentary spine. So easy. So when we say hematobium, T for terminal spine. Then we have leta hua, sota hua man, mansoni, to lateral spine, and hardly that spineless, that is going to be japonicum. Not only this, they also ask you in तीनों का location. They will give you one of these eggs and they will say which part of the body do they reside in, large intestine, small intestine, bladder, or where. So now maybe you can attempt one question. Which of the following localizes in the veins draining the ileocecal region? This is a very famous question. All schistosomas are written, one fasciola is written. Please don't mark fasciola hepatica because anyway hepatica word is telling me कि कुछ liver से related होगा. So it has to be one of these three schistosomas only. Yes, so that is going to be answer. All of you are giving me correctly. It is schistosoma japonicum. तो तीनों का एक बार जल्दी जल्दी देख लेते हैं. When I say schistosoma japonicum and mansoni, both of these are in the intestine. तो कौन सा small intestine, कौन सा large intestine? तो I and J come together. तो if they ask me which goes into the ileocecal venous plexus, तो ileocecal वाला will go into J वाला. That is going to be japonicum because I, J are going to come साथ साथ, they are neighbors. So this means the other one that is left, the large intestine वाला side, sigmoidorectal. Sigmoidorectal में कौन जाएगा? Sigmoidorectal में mansoni जाएगा. So simple, IJ, ileocecal japonicum, and mansoni goes to the opposite, that is the sigmoidorectal. So where is this hematobium going? This hematobium, if I tell you, hematobium was named so because it causes hematuria. मतलब urinary bladder, hematuria मतलब urinary bladder, it even causes urinary bladder cancer. So then it must not be going into all this intestine, it must be going into the urinary bladder wala venous plexus, vesical venous plexus it must be going into. That is why it's causing all urinary bladder related things. So simple, we have hematobium which will remind me of hematuria, it's going to the urinary bladder. Japonicum goes to the ileocecal IJ, and this leta hua, sota hua man, he is sleeping in that large intestine, that is the sigmoidorectal. Are we clear with this, with the eggs as well as the location? I hope there is no confusion. Shall we move forward? We have, I think, one or two more questions left. We go to this question again. Every year this comes, and this time also it is expected. Acha, sorry, before this question, someone asked me a question. कौन सा वाला urinary bladder cancer? Good question. See, ideally, S for S, schistosoma hematobium, causes squamous cell carcinoma of the urinary bladder more commonly than transitional cells. So ideally, it can cause both. Urinary bladder में it can cause both kind of cancers, SCC and TCC. However, if they ask you to, they tell you that select only one, then you will always select SCC over TCC. So S for S, schistosoma में squamous ज़्यादा common है, and the TCC is gonna be less common. Okay, moving on. Yes, what was the question over here, which many of you had already started attempting, which seems good, very good. Perfect. So we've already got an answer of B. B कुछ लोगों ने बोला, some people also said C over here. Okay. So देखो guys, when you read this, I'm sure a 12-year-old boy with cervical lymphadenopathy and a gray membrane, you have made a diagnosis of Corynebacterium diphtheria, but you did not read the question correctly. Which of them is ideal, and you are marking telluride, but ideal for what? Ideal for the earliest diagnosis. Time constraint hai. Potassium tellurite agar that all of you are marking takes 48 hours for the diagnosis to come. I don't have 48 hours. I want an early diagnosis. For early diagnosis, we use Loeffler's serum slope. So have a look at it. What was I talking about? I was talking about a case of Corynebacterium diphtheria. Corynebacterium diphtheria means that first and foremost, there's going to be a pseudo membrane that is going to be present. Point number one. After that, we have this kid is very famous, celebrity kid. Every grand test, subject wise test, even the main exam, even the books, everyone has this kid's pictures because of so many big lymph nodes. What is it going to be? It is going to be known as the bull's neck. So remember that pseudomembrane and bull's neck, this is the features that you see for Corynebacterium diphtheria most commonly. तो अब क्या करोगे? Sample कहाँ से लोगे? Either I can take an FNSE sample from the lymph node, or what can I do? I can take a sample from this membrane. Guys, where do you take the sample? Membrane में से sample लोगे or from beneath the membrane? Where are you going to take the sample from? We are going to take the sample from the area under the membrane. That is what you have to, because see, this membrane na is all dead material, necrotic, fibrin. I don't want to see dead cells and fibrin. क्या मिलेगा वो देख के? I want to see the organism. So I will have to take the swab from beneath the membrane. Very good. So I take the swab from beneath the membrane. Then I have two options. Like all of you were confused. Either I can put it into Loeffler or I can put it into potassium. This lamba wala naam, potassium tellurite agar. One of them is an enriched medium. One of them is a selective medium. So ye dekho. When I write enriched, how many alphabets does it have? 8 alphabets. When I write Loeffler, how many alphabets does it have? 8 alphabets. In how much time will the bacteria grow in it? In less than 8 hours. तो remember जो earliest diagnosis वाला है that is going to be this 8 hours वाला, that is Loeffler. It's an enriched media, it is Loeffler and it is 8 hours. So I asked you for early diagnosis, you had to pick up Loeffler. But yes, if you would have asked me which is the best, which is the ideal most, time is not a problem ma'am, which is the best one, then selective media is always the best. Potassium tellurite agar, and look at it, where this was taking only 8 hours, potassium tellurite agar is taking 48 hours. And there's a rule, whenever there will be a tellurite related media, the color that you will get will be black. The tellurite related media is gonna give you a black color. Is there any other name that we use other than potassium tellurite agar? Last question of the day. Last question of the day. Let me know. What is the other thing that you use, guys? Jaldi. And then we are wrapping up. No answers as of now, so I'm waiting. Black colored हो गया, potassium tellurite agar हो गया, so that is going to be छोटा सा homework if you don't answer. Tinsdale, okay, I've got the answer, very good. Tinsdale media. Tinsdale media is also what is said to tellurite वाला याद कर लो या Tinsdale वाला याद कर लो, that is going to be the same thing. So Tinsdale agar or tellurite agar, these are the two things that we are using for Corynebacterium diphtheria. Now I hope only ideal puchte, I would have also marked tellurite, but they asked me for earliest and that is why I selected the Loeffler serum slope. Yes. Okay, so Tinsdale agar, everyone's got the answer now, and yes, that's what we had to know. Actually, I'm sorry, there is one more question. I counted it incorrectly, so before you go and run away, I'll quickly show you that question. This is the last question of the day, and yeah, genuinely the last one. Which of the following is not a cultural characteristic of Bacillus anthracis? Lots of images. You can see the names and you know ma'am is going to show us 4 pictures. This was also the recent sort of FMG exam question came on this also. That's why I wanted to discuss it with you. Which of them is not a wire? All of you answering B. String of pearls reaction nahi dikhta. You want to say that? Okay, maybe you're not reading it. Some of you are saying Medusa. Guys, firstly, I've asked you what is not. पहले तो not पढ़ो. Everyone wrong. Some of you have given me a right answer. Okay. Not a cultural characteristic. See, all of these are seen in Bacillus anthracis. But I asked you culture characteristic. Bamboo stick appearance is not seen on culture. Bamboo stick appearance is a gram staining characteristic. Culture characteristic nahi hota. It's not a culture characteristic. So it was all about reading the question carefully. It's a gram stain thing. So let me show you all these pictures. This is all about Bacillus anthracis that you guys need to know in terms of picture. This is going to be a collage, and this is actually the kind of revision that we are going to do on Feb 17th, the mega revision day that I've kept. All your bacterias will be in the form of like all pictures in one place and jaldi labeling karke two questions we are going to do associated with it. So first and foremost, this is how Bacillus anthracis or anthrax presents. You can see a blackish color lesion. It's so black looking, so dirty, so excoriated. बिल्कुल भी अच्छा नहीं लग रहा. It's not a good looking lesion. It's quite a dangerous, where a deadly wala lesion. So we call it a malignant eschar. This is referred to as a malignant eschar. So this is the first thing that you have to know. There is nothing malignant about it. Okay? There is nothing malignant about it. It's malignant because it's looking a little scary over here. Okay? Now coming back, this is the question that came in the FMG exam. Which of them shows you the bamboo stick appearance or the box car appearance? Either you call it bamboo stick or you call it box car, your wish. So basic point is कि ऐसा लंबा लंबा bacilli होगा. They are bacilli, and because they are purple, you know for a fact that they are gram positive. Purple है तो gram positive है, and box car or bamboo stick appearance, just remember Bacillus anthrax shows you bamboo stick. Bacillus anthrax shows you bamboo stick appearance. After that, look at the culture characteristic. On a culture media, we see medusa head appearance. On a culture media, we see a Medusa head appearance. Someone's asking me, is this spore? Of course. Isn't Bacillus anthracis a spore forming organism? Yes. And can you see center में वो एक white सा area दिख रहा है? That white सा area is actually the spore. Because you tell me one more question now. कि is spore very good with taking gram stain? Spore के लिए gram वाला stain use करते हैं या कुछ और stain use करते हैं? पहले तो ये बताओ. For spore, what do we use? So remember, for spore, we have two things that you can use. पहले तो spore के लिए we can use the Schaffer and Fulton stain. We can use the Schaffer and Fulton stain. So that is of course going to be the S for S. तो एक तो ये stain हो गया. And the other one is going to be, we can also use the ZN stain. We can also use the ZN stain. So gram staining पे अच्छे से नहीं दिखेगा. Either you will use the S for S Schaffer and Fulton, or you will also use the ZN stain, that is acid fast. ZN stain पे क्या question आता है? That when you are trying to stain spore with a ZN stain, so how much percentage of H2SO4 will you be using? So the way you write spore, like I said, everything about a spore has to be around S. तो S से related कौन कौन से numbers आते हैं? S looks like a 5, S looks like a 2, है ना? ये सारे numbers आते हैं. तो 0.25 to 0.5% H2SO4. 0.25 to 0.5% H2SO4 is what we use when we are dealing with ZN staining of the spore. Is that okay? Yes. 0.25 to 0.5. छोटा छोटा, very less. तो 2 and 5 जो S वाले numbers है वो वाला numbers I picked up. Coming back. So yes, your spore thing is done. Medusa head देख लिया. Now look at this. You can see it's like those women wear that pearl string. It's a nice string of pearls appearance. तो string of pearls appearance कहाँ दिखेगा? The pearly appearance. Very simple. The string of pearls appearance PE is gonna be seen on which agar? Penicillin agar. String of pearls appearance is seen in penicillin agar. Very, very simple. Koi confusion nahi. Coming to the last one, you can see a nice inverted fir tree forming over here. Inverted fir tree appearance is on what? Inverted fir tree is seen on a gelatin stab. Inverted fir tree is going to be seen on a gelatin stab. So finally all your features are in front of you. Dekho, gelatin. Gelatin is culture media. Penicillin agar, culture media. Nutrient agar पे medusa head, वो भी culture media. Bamboo stick appearance is not seen on a culture media. Bamboo stick appearance is seen on gram staining, and that is what I had asked you. देखो, medusa head, string of pearls, inverted fir tree, all of these were culture characteristics. Bamboo stick appearance was a gram positive organism wala feature. This has been a PYQ, and always, it's just everything, but exam mein to read in between the lines becomes a little difficult because you're too anxious and panicky. But if you read the question carefully, definitely you'll get it, because इसमें कुछ भी नया information was not there. Everyone's okay with this? Yes. So we can definitely wrap up this session for the time being. And as I said, we are going to have a mega revision session also, which is going to be one of those breathless sessions where we're just like reading, jaldi. We have to look at all tables, all photos, so that all the important things are covered. That I'll post the link, of course, on Telegram. And yes, Dr. Manish, we'll try our best to include whatever we can. And अगर एक session में नहीं हुआ तो 2 sessions ले लेंगे, but we have to study that, right? Doctor exam prep, can you do? Yes, you can see the previous microbio for FMG wala also, of course. Microbio for FMG and NEET, there's not much of a difference, honestly, because at the end of the day, all the bacteria and viruses are equivalently important in both of them, and we study the same culture characteristics. So you can definitely refer to those also. Yes, that's going to be on YouTube, Dr. Anshita, right? So I'll let you know regarding 17th तक का classes. Definitely we will have something, but yeah, 17th को तो पक्का है. And as I was telling the other students, there is a plus class revision which is going to happen from 19th, 20, 19th, 20, and 21st, where there's going to be a PYQ, and 22nd also, where there's going to be a PYQ, and there's going to be a 4-hour rapid revision that we are going to conduct. That is going to be on the Plus platform. That will be a part of ye wala batch, the final booster batch that is going on. So there's going to be a rapid revision in there. For the other students, definitely on YouTube, we would be having a rapid revision. So yes, that is also going to be there. For micro, which course in plus, I just told you, Dr. BKS. So I hope you've noted it down. 19th को हमारा most expected question है, 20th को PYQs हैं, 21st को, 22nd को 4 hours का rapid review है. That is under the plus that you were asking me. Yes. So thank you so much for joining in. And as I said right in the beginning, acha, also we have a few FMG students who were asking me. FMG wala batch has already begun. FMG batch has already begun regarding the path and micro classes. The path and micro classes will start from April 1st. For continuity mein 12 to 13 days we are gonna have classes for path and micro, especially for students targeting the June FMG 2023 exam. So your batch has already started, so you can definitely start taking lectures under it, right? So thank you so much. And there will be a mega revision for patho. No, for patho we just had Jan 30 31st ko jo YouTube session hua tha, that was for patho. So I spaced it out in such a way so that you don't have both sessions colliding or back to back. So for patho that would be the one. And we've had one image thon yesterday also, right? For micro we are going to have a session now going forward. And of course closer to the exam we will have chota revisions. Those classes will always keep going on, so you don't need to obviously worry on that. That I'll keep informing you time and again whenever the classes are scheduled. But it's not that I'm not going to teach you any pathology till the exam. Of course we will have some small in between sessions just for confidence boosting, but no mega big session which we've had earlier. Don't want to repeat it over and over again unnecessarily. So that session becomes your gold standard for now. And yes, small sessions in between like these as confidence boosters, half an hour, 40 minutes, that of course we'll keep having. Okay. Thank you so much. Enjoy your day. As I said, for all of us, for all the medicos appearing for NEET PG exam, today happens to be a day which is full of love just in our head, love for our studies. So I hope you enjoy yourself, study well, and yes, wishing you all the best. Thank you.